in my review and like kind of talk with patients, I had to get to know that certain signs may be a big pointer and should not be neglected. We should listen to our body and know when to report. I'll be sharing a quick story of my interaction with a patient and how it's helped her get quick medical care, and she's better off today. Hello everyone, I'm Nurse Miracle Udeji, a registered nurse, and in this channel I share video content on health promotion and prevention. I'll be sharing this story so that you can learn from it and then know what it's pointing to, because I was watching a news report and they also making this emphasis on what called colorectal cancer. Some have heard it before. Colorectal cancer is as because it cancer affects an unusual growth that can affect the colon. The colon is the large intestine and the rectum is the outlet connecting the large intestine to the ant that connects to the outside. So now look at the scenario. I was like interacting to know, because she was recently diagnosed of it, although it's at the early stage. This cancer thing, when people feel it's a death sentence, but I don't believe so. Once you catch it early, it can be handled and then you'll be fine and you live cancer free. Okay, so she noticed first of all unexplained weight loss. She was, well, some people love weight loss, especially if that was already in your mind. I don't like my weight, I'm becoming too big. So if you start suddenly see that you are dropping, you'll be happy, right? So she said, well, that was not a problem since she already didn't want weight. She didn't like being big. But then she noticed muscle wasting. Take note, muscle wasting. Started her feeling, as if the muscle around her hands, her hands were, the muscle there were now sagging. People call, there's what they call Mother Mary hand, but Mother Mary hand is different. That one, the hand is a bit puffy and it's thin shape, but this time now it's like sagging like an elderly woman, a grandma's hand, where the bone will go on side, the little muscle that is there, or flesh or skin, will be saggy. So she was like, this is not supposed to be. And then she noticed that, and immediately when she noticed that particular change in sagging, started to see a medical doctor. That's why you should not take signs, changes, drastic change in your body. You should know your body very well, so that when you notice any change, okay, this is what I should do, this is what in fact, this one is becoming unusual, let me see the doctor. So she immediately went to see the doctor, and then they did certain investigation. That was why in one of my videos I told you that blood in the stool, sometimes it may not be obviously noticed, especially if it is a minute one. It will mix with the stool that you wouldn't know, except you do a blood occult test in the lab. You give a portion of your stool. They would do the lab technicians, the medical lab technicians, they know what they do. When they find certain things in your stool, it will point to the fact that there is blood in that stool. But with your natural eyes, you cannot tell that there is blood. But with that occult test, they will be able to tell if there is blood in the stool. So you see why those tests were necessary. So when they did that, they discovered blood, in that there was a traces of blood. Then from there they began to do certain things, were subjected to certain scans. Then they were able to trace a location where it just started forming, and at that early time it's easier to just treat and go, and then the case was handled and so on. So please, colorectal cancer is not for the old anymore. It's before we feel it's becoming very common than we think, and it's one of the leading causes of death, especially among Africans. So please, when you notice certain changes, if you notice even maybe the way you use the toilet and the way you're using it now, there's a change. Maybe before you used to go to toilets twice a day. Now you can stay 4 days without going to toilet, or you go once in 4 days. That drastic change can be a pointer to certain things. So please, we shouldn't just take our health. The earlier we attack a disease, the better. If it's left and ignored, it can get to chronic conditions where it's once a cancer metastasizes and spread, it becomes more difficult to manage. So I just share these basic signs so that we can look at these pointers and watch it. Thank you. If you like what you watched, please, and you want to be learning more tips that can help you prevent disease and promote your health, please like, share this video, subscribe to this channel, and I'll see you some other time. Thank you.